Hello people, in this video let us look at this topic, feeling tired. What could the causes be and what you should do as a doctor? So feeling tired with no other symptoms, okay? So it could be because of lifestyle. The person is eating more, eating less, having more physical activity, having less physical activity, having less sleep, more sleep, having stress, etc. So in my recommendation, eating less after 6:30 in the night gives a lot of energy, but that is up to the person to decide. Okay. Now, the blood test that you will order, that is complete blood count, hemoglobin. You will check for anemia because oxygen carrying capacity could be less in that person. WBC, you will check if there are any infections, right? That is total leukocyte count you will check. So that is complete blood count. Then you have fasting blood sugar and glycosylated hemoglobin, that is HbA1c. So these two will indicate if the person has diabetes, right? So this is something that you will have to include in the blood test. Vitamin D. Vitamin D is very, very important. Though we are in India and we think that we have a lot of vitamin D, the reason I had deficiency, I have deficiency of vitamin D, for which I'm under treatment for last 3 years. So you have to check that. If vitamin D deficiency is there, it can also cause calcium deficiency. So please check calcium levels. The birds around are very hyperactive. Anyways, so now let us look at the other tests. Peripheral smear, which will give you a complete blood picture to show you if there is macrocytosis, microcytosis, normochromic or hypochromic, etc. Right? But the thing is, with peripheral smear, sometimes you can get incorrect values. So you always look for vitamin B12 deficiency separately, because vitamin B12 deficiency is so common. People just come in to my family doctor every month, right, to take injection of vitamin B12. Okay. Then magnesium. Magnesium could be a cause of fatigue, but however, my doctor has not prescribed magnesium tests for me. Okay. Then coming to serum electrolyte, where you will check for sodium, potassium, chlorine. My levels of sodium, potassium, chlorine are all fine. Sodium, these things can cause fatigues. Yeah, serum electrolyte, you have to check, very important. Thyroid profile, where you check for T3, T4 and TSH. You check for all the three because that gives you a complete picture of the thyroid working. Remember, hypothyroidism can cause lethargy, right? You don't feel like doing anything in life. Hyperthyroidism might keep you hyperactive. So you have to check thyroid levels. Lipid profile, cholesterol, HDL, LDL, all that you will have to check. Okay, lipid profile also important. Coming to kidney function test and liver function test, very, very important. Kidney function test will indicate how good of your clearance is, urea, creatinine, etc. Liver function test again will tell you the levels of bilirubin, which could be causing fatigue, or the enzymes of liver, which could be leading to fatigue. So these are the blood tests, people. Urine routine usually goes hand in hand, and urine routine is very cheap. Okay, don't worry about that. So it will indicate if there is any loss of glucose, protein, blood, RBCs in urine. Okay, ketone bodies, nitrates, etc. Nitrites or nitrates, all that it will indicate. Okay, we will look at all this in detail. Just hold on. Then you will get whole blood packages which cover all these blood tests and urine analysis. It might cost around 3,000 rupees. So just you can walk into any lab to get all these tests. ECG as such will be recommended by a doctor if he sees that there is shortness of breath or cardiac cause, if it is suspected as a cause of fatigue. Regular deworming with albendazole 400 mg would be recommended as a routine. Okay. Look at the urine routine. We'll start with this. So you can see the mainly that you have to look at this is there is no protein loss in the urine. There is no RBCs in the urine. There are no bacteria in my urine, right? So there is no WBCs also, it should say, epithelial cells. So there is no indication from the urine as to the cause of fatigue. Look at this hemoglobin levels. What do you think hemoglobin's levels look like? Hemoglobin 12. Very good. Total leukocyte count 5000 within the normal range. The differential leukocyte count has been given here. Coming to platelet count, it looks fine. 2 lakh And then coming to ESR also, it looks fine, which is anyways non-specific. Fasting blood glucose looks fine, 80, it should be within 100. So you should go the next morning, right? Morning you should go. After a night of fast, morning you should go. Night anyways you're fasting. So morning you should go and give the sample before eating anything, drinking coffee also, okay? HbA1c, that is glycosylated hemoglobin, well within the range. Look at this. The problem actually for me was vitamin D, severe deficiency 7.1. It was dropping, and I have been ignoring it because of ignorance, or what do you say? Oversight. Basically, you should always show your reports to somebody else, is what I feel. Okay. So vitamin D deficiency, very common, and causes severe fatigue. Look at the calcium level, also low because vitamin D is low, right? Vitamin B12 looks fine. So this is how peripheral smear would look like. Like I said, magnesium has not been checked for me. Now let us look at the report finding serum electrolyte and all these. Serum electrolyte, very important, sodium, etc. These levels will determine if the cause of fatigue is this. Thyroid profile, that is T3, T4 and TSH. Again, there are a lot of other types, I'm thinking. And these vary by pregnancy also. Lipid profile showing the cholesterol, HDL which is good, LDL which is bad. My kidney function test showing urea, creatinine, uric acid levels, protein levels in the body. Liver function test indicating bilirubin, liver enzyme levels, albumin, globulin ratio, etc. Because I took whole body package, they seem to have checked iron also. I'll show you that. Total iron binding capacity, etc. However, my doctor had asked me to get ferritin level checked. So here you can add one, I think in whole blood package you will get that. And if there is iron deficiency, it will show up in the anemia also. So basically those are storage iron, ferritin, isn't it? So in this video, we have tried to cover all the causes that you should check for as a basic level for fatigue. Feeling tired, anybody comes, you can check for these. Okay, that's all for now. Bye bye.